So the BCRF actually rescued a floundering randomized research study that tested a low-fat diet compared to a very low-fat diet in women who had already had breast cancer. That trial was called the WINS study, and it actually ran out of federal funding because that kind of a trial takes 2,500 patients and a half decade or a decade of follow-up, and although they had grant support through the beginning, the federal funding dried up. And the BCRF actually came in and provided an infusion of cash that kept that study alive. And that study is broadly labeled positive. There are a lot of nuances and subtleties to it, but you can summarize it by saying it's better to be thin than not. And maybe there's a smidgen of evidence specifically for breast cancer. We could have an entire day discussion with the people on the panel about the interpretation of the trial, and I think we probably don't want to do that. But what we can say is it's better to be thin than not.
Overall, when we looked at specific dietary factors, type of fat or fruits and vegetables, we didn't see much relation with breast cancer recurrence. But the reality is that many of the women are not dying of breast cancer, and that's the tribute to what Dr. Lippman was saying, that survival is really good from breast cancer now. And so women who have breast cancer are in most ways like other women, and heart disease, diabetes are still going to be threats, and those, a good diet and lifestyle will do a lot to prevent. So after the diagnosis of breast cancer, the good news is that you will receive the same benefits of an overall healthy diet, not smoking and physical activity, for the preventing the other things that are, in fact, because of good survival, the biggest threats for many women.
Judy?
I think it's fortunate that Walter could give us a hopeful message there, because I wasn't sure after a while that it mattered what you did, but actually it does matter what you do, and it may not only be breast cancer that you're preventing, but maintaining overall health seems to be better overall if a long and healthy life is your goal. For women who've had breast cancer, and especially women whose tumors were estrogen sensitive and took tamoxifen or an aromatase inhibitor, some of the most powerful data from those studies is how well those drugs prevent a new breast cancer from developing, not just how well they prevent the one you've had from coming back, but the clues that these drugs would be preventive agents in women who've never had breast cancer came from the fact that they could reduce the risk of a second breast cancer. Women who've had a breast cancer are at increased risk of another one, which kind of makes sense. All the breast tissue was exposed to whatever it was that caused breast cancer the first time, and it's only sort of an anatomic accident that they come as a pair instead of one, which is a little weird to think about. But nonetheless, that since these drugs do that very effectively, you may have had that additional benefit while taking the drug for another purpose. And of course, this whole risk-benefit issue, you may make very different decisions when you face a breast cancer than when you're trying only to prevent one. But all of what we're talking about today is about this kind of weighing risks and benefits of breast cancer, of heart disease, of other things. It's all got to be weighed for the quality of your life overall.